Hey everyone, this is Hannah. I have your Rocket Miner COVID-19 update for today. Today, unfortunately, we heard about the first COVID-19 related death to occur and be confirmed in Wyoming. A hospitalized Johnson County man who was confirmed to have COVID-19 has died, according to the Wyoming Department of Health. They said that he was an older man who had health conditions that put him at higher risk of severe illness and complications related to COVID-19. And this is the first reported death that is confirmed to be associated with the virus in the state. There has been some amount of discussion about listing COVID as the cause of death with different people in different cases. Some people are saying that hospitals are inflating the numbers by always putting down COVID-19 as the cause of death. There's a lot of discussion around that, but I have heard different things from people I know who are healthcare workers and from other good trusted sources that say that there is a valid reason for hospitals doing this, that anyone who has been confirmed to have the virus, or it was almost certain that they did have the virus, it makes sense and is accurate and is helpful to put that down as the cause of death. Cause of death is always a complicated issue. There are always multiple factors at work in most cases, especially these cases. And a lot of these people did have weakened immune systems or underlying health conditions, but in pretty much every case, it's almost guaranteed that having COVID-19 is what ultimately caused the complications that led to their deaths. In most of these cases, despite their already existing health conditions, they probably would not have died at this point if they hadn't gotten the virus. So, and it's important to keep track of these numbers so we can keep recording and understanding the virus and how it works and how it affects people. And that helps doctors and healthcare workers and people know how to respond and how the virus is affecting people. So it's important, and it is almost always completely valid to put COVID-19 as the cause of death. Also, we just have to remember in all of these cases that these are people's lives, and these are people who have died, and we need to be concerned about that. The governor and Alexia Harris all expressed their condolences for this man's family, and I think we need to be doing the same. Certainly our hearts and our thoughts and our prayers go out to this man's family and everyone who is grieving his loss right now. And while we talk about numbers and statistics, we need to remember that these are people's lives, and it's important to be compassionate and be empathetic no matter what the circumstances are. So today in Wyoming, the Department of Health is confirming that we have 275 confirmed cases, 98 probable cases. There are 140 confirmed recovered cases, and now we have the one confirmed death also. So Platte and Weston counties are the only two counties in the state who have no confirmed cases at this point. Several Wyoming health officials have been discussing the virus in Wyoming and what we can expect, and trying to make predictions about how long they think it'll last, what to look for in the next few weeks. Several officials are predicting that Wyoming is going to see a surge in cases at the end of April, and then we might not see the peak of the cases until the first week or two in May. Dr. Nick Stamato, the Chief of Medical Staff for Campbell County Health in Gillette, said that most of the computer models they have to predict the spread of COVID-19 are showing that surge in cases in the last week of April, and the cases peaking in the first or second week of May. Andy Fitzgerald is the hospital CEO there, and he said that these projections are actually improving over the past few weeks looking at Wyoming. A quote from him said, "As we've preached to our community to stay home, people are adhering to that. So projections are headed in the right direction. The curve is flattening. The surges we expected are less today than even a week ago." So a week ago, when the same health officials were looking at these projections and these numbers, the timeline was pushed even further back as far as when we would see more cases coming. But as people have been staying at home, we have been helping to flatten the curve, which is making these projections look better than what they did. But these same health officials are also warning that we need to be smart and be careful and cautious about this, because as people hear, oh, the curve is flattening, we're getting back to normal, we'll be fine. And then people want to go back to living their lives just like normal again. And we need to be very careful that we don't jump the gun and get into that too quickly, or we're just going to cause more problems. In Fremont County, which has the third highest of the confirmed cases in Wyoming, Dr. Brian Gee, the county's health officer, warned that even after the number of new cases begins to decline, the emergency isn't over. Just because the curve is flattening doesn't mean that we're back to normal yet. He said, the peak has to come down. We're going to have to maintain these physical distancing tools we've been doing onward into the spring and into the summer. So he's predicting that as far as social distancing and self-isolating and trying to stay home as much as possible, that's going to have to keep going on for a while. Part of this is that Wyoming as a state was kind of behind the curve of the rest of our country as far as getting the virus and as far as cases spreading and multiplying. So because it came to us a little bit later, that means that our peak in cases is going to be slightly behind other people's. So it might take us a little bit longer to be able to flatten the curve and get back to normal. So we have to be ready for that and preparing ourselves for that. And as much as everyone wants to go back to normal as soon as possible, like I said, if we jump the gun and if we try too soon, we're just going to make it worse and we're just going to push the timeline back even further. Andy Fitzgerald, the CEO of Campbell County Health, said that if things went back to normal today, we just open ourselves back up to the threat. And he said if we tried to go back to normal, the outbreak would start again, and it could be even worse than it was before. So as much as we're having these discussions and these debates, and some people around the state are protesting about wanting to be able to go back to work, there are valid concerns about the economy and about how we're going to handle this. But I think it's really important to listen to these health officials who know what they're saying, and they care about our state, they care about our economy too, but they are trying to do the best in the long run for all of the people in our state. This is a very serious issue and it needs to be taken seriously, and people are dying, and if we aren't careful, those numbers will just keep getting worse. I saw today that the number of COVID-19 deaths in New York City alone has almost doubled the number of deaths from 9/11. And that was really staggering and sobering to me to realize that. And that's just in New York City. And I know that they're being hit very hard, and definitely my heart goes out to them, and I hope that they'll be able to, start seeing improvements in that, but they have been hit so hard and seen so many deaths, and these are people's lives. Again, these are real people, this is a real threat, and there's a lot of discussion that can happen about the best things to do and the best way to handle things, and the concerns about our economy are also important and valid, but we need to realize what's at risk here and take it seriously. In more uplifting and positive news, the Western Wyoming Community College Student Nursing Association is doing an online basket raffle this week. So just today they posted pictures on their Facebook page of these gift baskets that they're giving away. They're super adorable gift baskets. One's kind of like a game and movie night theme. One has a bunch of paper towels and hand sanitizer and things like that. There are 4 baskets, and they all have their own theme with a lot of good stuff in them. So you will have 1 week to buy raffle tickets to go towards any of those baskets that you would want to win. Tickets are $5 for one ticket or $20 for 5 tickets. And all of the proceeds that they get from this are going to go towards making care packages for the Sweetwater, Uinta, and Lincoln County first responders, medical personnel, and law enforcement. And we'll be sharing a story soon with more information about that. And to get all of the details, you can go to the Facebook page for it, which is the Western Student Nurse Association Virtual Basket Raffle. And you can see pictures of the baskets, and there's information about how you can pay for the tickets, so you can check all of that out there. I think that's an awesome idea and a great cause, so be sure to go check that out. And as we look at things like that, we look at the numbers and we're having these discussions about flattening the curve, about the effects on our economy. There's so much going on, and there's a lot of valid reasons to be upset or stressed or frustrated. But I just want to encourage everybody that all of us are going through this together. Literally the entire world is going through this together, which is so unique and so different for all of us to be fighting the same enemy and under the same circumstances. And it's hard and it's stressful and it's frustrating, and there's a lot of hard stuff about it. But I just really want to encourage everyone during this time to just be kind and be gentle and be patient. Be patient with your family members, because everyone who's cooped up together is going to be driving each other insane on an even more regular basis than normal. So be patient with the people you live with and be kind and caring to them. Be patient and kind with people you engage with over the internet. Social media can turn into a very nasty place sometimes, and people get into comment wars and people say things without thinking sometimes. But if you are engaging, just engage thoughtfully, think about what you say before you say it, and just try to keep in mind that there are other people on the other side of their screen, and they're human beings too, and we can have rational discussions about things. It's good to discuss these things that we're concerned about, but to accomplish any good, we need to do it in a kind and thoughtful and respectful way. And be gentle with yourself. All of us are stressed and frustrated, and it can be hard to get things done. It can be hard when you feel like you're just upset at everything all the time. Just know when to allow yourself to be upset, know when you can do things that will help cheer you up and keep you having a positive outlook, but be gentle with yourself and let yourself grieve as you need to, let yourself have days that are just not productive as you need to, as we all try to just rest and stay sane and safe and healthy during this time. Just remember to be kind, because that's what's going to help us all get through this together. Thank you guys so much for listening. Keep checking our website and social media and the paper for more updates, and we'll keep sharing information with you. Thank you. Have a good night.